So good afternoon, everybody. Welcome to today's CR2C2 seminar. It is a pleasure to have Dr. Qian as a speaker today. You already have received the flyer for this talk, and I don't want to go through the very extensive accomplishments that Dr. Qian has already made and included in the bio. Briefly about him, he has a joint appointment with the Department of Civil and Environment Engineering and also College of Information Systems and Public Policy at Carnegie Mellon University, CMU. So he directs the Mobility Data Analysis Center, MAC, at CMU. Dr. Qian's research interest lies in larger-scale dynamic network modeling, larger-scale data analysis for multimodal transportation systems. And today's talk is about Rural Mobility Service Platform, RAMP, which is about the optimal design and pilot in Greene County. So this is very much well related also with the CR2C2, which we are also exploring to deploy technologies, connected technologies for rural transportation systems. And then this is, we are excited to hearing this talk, Dr. Qian, and the stage is yours. Thank you again.
Thank you so much, Ali. I really appreciate it. This is such a great pleasure here today, having me to speak to some of the most recent work we have been doing. I realize it's very hard to squeeze everything, a few years of work into a few 20-something slides. And I also would like to clarify that a lot of what I'm going to present today are some still in progress. I would love to exchange more ideas with all of you just to learn more about from your perspective and how we can make a better design, understanding both the demand and supply side for the rural or suburb kind of transportation systems and to improve accessibility of local communities to different type of essential resources. And since this is very relevant to what you do, I'm very, very excited, just to tell you a little bit what we did in the past. And just to, again, I hope this can be very interactive. So please stop me anytime if you see something that we can discuss more. Certainly, I think it's just meant to stimulate a lot of discussions and to see how we can collaborate in the near future. And let me just quickly share my screen. And, so can you all see the slides, right? Just make
sure.
Okay, cool. So just a little bit of history, and this is we started the project in the RAMP. We give a name, Rural Mobility Service Platform RAMP. This is a DOE Department of Energy VTO office sponsored project starting 2020. But prior to that, we had some work mostly focusing on developing first mile, last mile mobility services to connect the main high capacity route transit. That was sponsored by US DOT's UTC Mobility 21. That was during the year of 2017 to 2019. And with some algorithm, some deployment that we did through the UTC program, then we kind of spend more ideas for specifically for rural. And then in this case, it's not just the first mile, last mile anymore. This is just expanded to kind of regional scope. And of course, this is I haven't done anything. This is really attributed to all my postdoc students, and I should bring up the names and to Kenan, Bing, and Rick. And so I'm only had the privilege to today to talk about some of the work, but then the work is all from the entire team. And I should also speak to some of the partners. And this is project that, again, this CMU is the lead project, sponsored by DOE, and we also have local partnerships that over the times I realized how important this is to engage local communities. Well, we're talking about not just the government agencies, commissioners' offices. These are still considered as legislators, the city officials, But I think more importantly, for any of the rural communities, even any community, not just the rural, I think it's important to have local community leaders, advocacy groups, understanding what the people needs are, not necessarily aligned with existing policy, but I think understanding what they need, that's one of the reasons why we did a lot of surveys with the help from local community leaders and nonprofit groups. And so this is again, this is a group work. Okay, so rural mobility, I will start to tell you a little bit the question we've been encountering here in Greene County, and then we started with the bottom-up approach. So we initially, actually the whole history of this project is we started with I run into someone who I know very well, but he runs a little farm in the rural county and in the rural county here in Greene County, in another county called Somerset County in Pennsylvania. And then he told me a lot of issues about the rural mobility, and his only issue is really how to get his products from the farm to places where in the central city, or part of the central cities or some other states. And so southwestern Pennsylvania, if you're not familiar with the geographic location, it's a neighboring West Virginia and Ohio. So it's important to kind of move all these commodities to all these local neighborhoods, and also grocery stores and things like that, right? Building a little supply chain locally. Also, importantly, he also wants to attract some of the workforces to work for his farm, but there's issues to get things around. And then later on, when we talked to some of the local, we sort of think about this is a really interesting problem. And then we started to have more discussions with local communities. And then we realized it's actually a much bigger issue than we thought. Again, that was probably back to 2018, 2017 time frame. And then we realized maybe it's also the case in Alabama or in North Carolina rural areas as well, but I'm only speaking to the numbers that we collected in southwestern Pennsylvania as well as West Virginia. So you can see this is a county roughly about the 35,000 population, a relatively low income and comparing to kind of average income level for the entire state of Pennsylvania. And right now, there's no fixed route of public transportation services, right? Everything is based on the day ahead reservation based. It's typically people call it paratransit in the city, but it's very much like a paratransit in the rural in this case. And any citizen is able to use the service, but it's very expensive. So if you are paid by Medicare, Medicaid, and healthcare services, even with the reimbursement, we're talking about the true cost and not talking about the not the face value of the fare system, because we all know the fare is being highly subsidized. The true cost to run such a paratransit services only for healthcare mobility, healthcare related services, not even talking about the jobs, but not talking about community services, not talking about the shopping, food shopping. This is only strictly to medical purposes. The true cost of running such a service is on average $30 a trip. That is very expensive. And on top of it, if any general citizen want to use the service, that's why they call it Greene County Transportation Services. It is actually additional $30-something, up to $30-something depending on the distance. It's a distance-based fare. For most of the people who take advantage of the kind of medical reimbursement program, it is a very, very low cost to them on face value, but the true cost is $30 per trip. But then if they really have to pay for it, it's actually more than $30 that they have to pay if you really want to go to see a doctor in Pittsburgh. By the way, just to give you a little bit more background, Pittsburgh is roughly about an hour away, 50 minutes, 55 minutes away, to the Waynesboro. Waynesboro is the really county seat of Greene County. It's not so rural in the sense that it's still close to the city, but it's in terms of population density, it's very rural. But geographically, this is still it's considered as a suburb, and that's why geographically this is a really interesting place. people have certainly have you know, if we can provide the right mobility services, people can have a very good access to resources in the city, but the problem is how, right? And then also the other reason that DOE is very interested on funding this is we know that typically in the rural transportation, the energy is very intense because that means a lot of times it's a very fuel consuming vehicles, less efficient fuel vehicles are running these being driven and from place A to B, and there's very little shared services. And because of that, the energy consumption per person or per trip is relatively high. And also because this is really long distance trips, most likely in the rural communities. And we're also looking at the aging population in this community. And there's a lot of veterans, and also because the vehicle are typically very aged, not only they consume more energy, but also the other issue is these vehicles are not reliable. Even though I have a vehicle, but it could be a 1999 some vehicle, and then you know, the often this is something I learned in practice. Like when I talk to people, I didn't really think about this was an issue. Even though someone has a car, they still reluctant or hesitant to kind of use this vehicle because it could be. I mean, what's the chance? There's a very high chance to see a vehicle breaking down in the middle of the trips in 10-15 mile trip. And then for them, they had a lot of issue just to even call for help to get the vehicle back to work. Also, this is the county where you can see this is roughly about I think 50 miles or so by 50 mile square area. Roughly about the 4G coverage is only roughly about a third of the county. So, and oftentimes when I talk to people looking for solutions, then they can say, hey, you know, why don't you just get more Uber services there, or maybe just call for some sort of services and people can, you know, request the services. But it's actually not feasible in this case. There's no Uber, Lyft, no driver wants to go this place, which is also creating some kind of social equity issue as well. Leaving that out, there's a very little kind of broadband, more of talking about the wireless, right? The communication, leveraging the communication technologies to even just to get people around, knowing there is a vehicle coming to pick them up, there's the issue. There's more issue about even though a place is 4G covered, that 4G covered area could itself being siloed. That means people reluctant to go cross a black hole where there's no coverage at all, and then, you know, before they can hit a place where there's 4G. Yeah, imagine that the running services like this, there's a big issue because there's the middle of the road, there's no coverage, and then, you know, people, the drivers or whatever the service providers could potentially be intimidated by this type of situation. And then that's why you will see later on when we're right now running the pilot, and we had to start with somewhere, and then we certainly it's a very unfortunate that we cannot cover these areas for now, but we're still looking for other solutions. But it's just kind of throwing out a lot of the issues in the rural county, which when we live in the city or maybe in the suburb areas, we feel very privileged. It's actually, we're very privileged. And when it comes to the real world problem, there's a whole lot of issues that we need to tackle. And then here are just some of the issues that we think is very important. We cannot solve, and in this case, we did not solve everything, but we hopefully we can at least address some of the issues. We're certainly I'm all ears to learn more about your perspective, right? I already talked a little bit about this, and in general, in this rural community, there's a lot of issues to people to get around. It's inefficient. The service itself, mobility service right now, it's inefficient, is insufficient, because there are certainly, when we do a survey, we understand people want to get around. It's just no way for them to get around. And then because this is a trap, because the more people not being able to make trips to access jobs, access food, and the more they're trapped and economically, so there's less likely for them to make to afford any of the mobility, so afford a car, for example. So there's other issues, you know, economic development issues as well. I should also point out this very uniquely, I believe this may also exist in many rural communities as well, even though everything is very scattered in this rural community, low population density, but is this one university called Waynesburg University, which is also very unique because they are the campus itself is actually high population density, relatively high. It's not so high, but they have roughly about 2,500 students and 500 employees, and including staff and faculty, with something else. And it's generally have roughly about a little over 3,000 population in this little campus. And we also learned that even the students, some of the staff, they also had issues with getting things around. Even if they want to go to a place to shop, which is there's a Walmart center about 2 miles away from the campus, they also had a lot of issues to get around. The university doesn't, they provide some mobility services and, you know, once a day to get people around to shop, but it just it's super underutilized. So we were thinking just maybe there's a way to leverage kind of you know, the high population density within which is very rare in the rural county, but exists, right? And then how can we kind of looking into the imbalance of the relatively high density versus in general, it's a very low density population. And then again, this is really about understanding the demand. So the goal here is that we, you know, basically we have two goals. One is to understand in the rural county, using Greene County as an example, what are the potential demand, what people want. If we were to provide some kind of shared mobility services to get them around, of course, we also have to consider the cost upfront, right? If it's a reasonably costly mobility service, how many people were likely to use it? What are the characteristics of the population who are likely to use it? And namely, the targeting the demand market is something we want to know better. The other thing is about the supply. If there is a demand, and what kind of service should we provide just to get people around? What's the most effective, cost-effective service? And specifically for rural communities. And in this case, we're only limiting the trips, whoever will provide the service trips to essential trips as only. And now we're not talking about recreational going parks and having fun, but this is more of a essential trips like jobs, healthcare, food shopping, and community services, religious services, things like that. So this is just kind of set up the expectation, the scope. Okay. So very quickly, I think I spent a lot of time. I just want to give you a little bit of background where this project coming from. And then so that kind of go, it's a very good segue to go to the first bucket we did is based on the demand analysis. First of all, we want to understand people. And I'm not a social scientist, but I'm trying to do as much kind of social, sort of the demand model as much as we can. We did enroll IRB, do the widespread survey, just to design the survey, just trying to understand people better. And I'm going to go very quickly on some of the main designs. So here's what the survey in general look like. Oh, by the way, if we're happy to share everything, all the survey data, everything to all of you. If you think that can be really helpful, then I'm just shoot me an email. Like I said, I'm super excited to see any opportunities that we can collaborate, and maybe we can use your data, you can use my data, so things like that we can discuss on the way. But this is the concept is that we are throwing out this idea to people before we do the survey. We tell them, hey, if I know things, you're very stranded right now, there's no way you can move things around. Can we provide a affordable, reasonably priced shuttle service, meaning that we can get you around with some expected waiting time, but it's gonna make it feasible and then with a reasonable cost. And the shuttle services has two aspects. One is that we can provide some kind of centralized service, and it's based on dispatch. People can come, you can request, and we'll dispatch vehicles to pick you up and you share with others. Or it could be some kind of volunteer-based sharing services where, because in the rural county, in this particular case, there's a lot of veterans, there's a lot of community sense, I think is probably much better than some of the community in the city. So some people are willing to volunteer to move people around, and they can log into a service like, hey, 7 to 8 a.m. today, I am available to volunteer, right, just to get people around. And then we try to build the kind of integrate these both services together. And then we tell them, hey, there's possibly there could be a volunteer-based services for you as well, depending on how busy the system is. And the survey was try to give them some context, and then we want the goal of the service is try to understand how much of in terms of the pricing, in terms of how frequent you want the service to be, in terms of your trip purpose, in terms of social demographics, and also given kind of reasonable service, the type of service that we're offering, because there's a way to familiarize the people with this type of service. Maybe not everyone knows how to take Uber type of service. Not everyone knows that some of the trips that can be flex stop, it could be hailed. So it's assuming that they have some reasonable knowledge, and we also want to know whether having some familiarity with the services is really critical in your decision making. So, and then with that in background, we actually send a survey to cover roughly about a little over 400, and our target is 450, but we didn't get as far. We have a little over 400 general citizens in Greene County and 450 university affiliates. Like I said, we treat the university in this case as being a very special case. It's high density. There's certain demand that students want really to go shop and to find the jobs locally in local farms, and this is to us it's a two separate population that we're studying. So again, this is just to give some background, and then of course we look into some of the ways to mitigate control for bias, and we go to places where people are more likely to use the services rather than going to for example, shopping centers, Walmarts, right? Because depends on whoever has a vehicle. If you survey them, certainly that's unlikely to use the service. But if you're talking to people who shop in the Walmart, they are coming with some other different ways. For example, there's a senior shuttle, right? Or some local nonprofits provide shuttle services to get some senior citizens to go there, and then we will survey. We just kind of more of a targeting. Surveying those folks, but we also try to get a reasonable balance. We kind of survey randomly, pick someone without necessarily knowing where they come, with driving a vehicle or without driving a vehicle. To most likely they do drive a vehicle to go to Walmart, but there are places where like churches and gas stations, or some places where that's where we get a lot of local community help, and they're really helping us to get all these work done. A couple graphs I want to show you, and then I show you a model with some of the descriptive analysis and the quick model. And I think that there's technically a lot of details that we can discuss, but just quickly show some of the main takeaway messages. So this is really, I figure, very interesting. The orange dots are what the paratransit service, for the sake of having the name that could be more understandable. This is the Greene County Transportation Program. It's almost, like I said, this is almost like paratransit service right now. The orange dots are where the service, we look at past the 5 years of data. This is where people request the service to go to, and then where they're from. And you can see and then these are orange dots, right? And the red dots are where in the survey, people said explicitly, hey, this is, if you have the shuttle services, this is an intention, kind of ultimately where I want to go. If the service becomes available and reasonable, I can afford it, we're talking about a few dollars, and this is a place I want to go with their service. You can see such a big discrepancy between where people is being served right now, the type of trips are being served in terms of origin destination, versus where the actually people want to go. And then you can see the blue dots actually are some of the point of interests that we think we actually crawled 500, 600, something point of interest using Google Maps. These are places where we believe people might want to go. And then we also checking with the local nonprofits and making sure it's on they also agree these are locations based on their experiences, then people are likely to go. And then we also plot it on the map, right? These are the places it's not even served by any of the existing services in the past 5 years. And so again, this is give you some idea of how important this is to do the survey to understand the demand before we jump into making any assumptions where people want to go. I'm skipping this, but basically we have a survey, we have some information, and then what we try to do is to see, we want to have a little quick model just to understand, hey, what kind of market are we talking about, and then where should we, if we offer service, who are more likely to take it, therefore we can understand the demand. Because only if we understand the demand, we can sample the demand in this whole region, and then we can design the service supply to optimize the service to these demand. So that's why the reason we've spent a little bit of time kind of building a very simple demand model. And this is just kind of the binary, yes or no, whether I am going to I'm willing to at least try the services. In the survey, we did ask people, hey, with this and that, and then with the context, are you feel comfortable using, at least try to use a shared mobility service? And that's your outcome. And that's why it's a binary logic model, and with building in all the attributes and everything. Okay, so the model itself, I think it's a little bit getting a little bit technical and dry, but I want to present it to you. Some of the very descriptive takeaway messages, right? This is one. You can see that typically we look at the income. In this particular case, income level less than 75. People are more likely to consider to use it. In general, in the general survey, we figured that about 20 to 30% of the population that we surveyed, I have to acknowledge that there's a lot of bias that whoever we surveyed, but at least based on what we think people might try within this pool, and about 20 to 30% of people said they will they'll try. I mean, these numbers are not rescaled in any because we just, this is the raw data coming from data. We have another graph that just based on search demographics, we try to rescale everything based on income and the housing. And there was another thing I blind for a second, but we based on 3 factor, we try to rescale it. But this is just want to show you kind of raw data. This is biased, I should acknowledge, but I think it's good to also looking into from people we surveyed, roughly about 20 to 30% population are willing to try. Not a whole lot. Even in the university setting, you can see they are more likely to be highly educated, but still roughly about 30, a little over 30, I would say, willing to try. Not everyone. And that's also kind of what we want to know when we design the services. And in terms of the age, and the percentage-wise, I think it's the younger population is more likely to try rather than senior citizens in general. But we did see that about the middle age and 35, 50. So this is also a particular type of population, because they typically have the much bigger, in this bracket, that they have the total population is much higher. So that's also a potential market that we should get into. In terms of the time of day, people all claim that they want to use the service during peak hours, indicating how important this is to provide a reliable service to them so that they can access the job and food, which is more of their day-to-day routine. Lastly, I want to show you this household size. This also makes sense as well, because the more typically people with a house size of less than 5 or 4 more likely to use the service. This also tells you that in rural county, this is also anecdotal, but I believe this is true, is that if they have a company, let's say have under 17 years old, 16 years old, or maybe even 10 years old kid that go to schools or go to different places, community churches, and I think it's important for them also to bring in some underage teenagers, right, kids to go with them. So essentially, if we can offer some of these services, anecdotally, this also graph also proves that they will consider use shuttle services, not just a single adult. It could be some minorities also comes with adult to use the service as well. So this trip purpose, again, we are limiting to essential trips, but you can see most likely people are most interested in the work-related and shopping-related trips using this type of, that also highlighting how important this is that for us to offer kind of the most reliable, day-to-day reliable services to them. We fit a model. You can probably look at the random factors just to give you some sense of how what are the main driving factors, right? People, you can see the age and also the model, by the way, a model fits this pretty well. A few takeaway messages really in the rural county, we found that considering inconvenience is a very important factor, which probably the same as rural, as in the city. But in this case, I should highlight that it's very important for them this is about, one thing is about what they perceive. Rather, in contrast to what actual time waiting or things are. But I think that having them to tell them, hey, on average, you will be waiting for 15 minutes or so to get a bus to pick you up, not the instantaneous, arrivals. I think people will understand. That's why when we designed the app, you can see I have a screenshot later. That we try to make sure that people are aware of where the bus is and so ETAs and keep updating it. This is also very important for them to see. So in terms of the age, income, this is also something I already discussed. One other takeaway message is the gender. So somehow in the survey, we tried also to scale it based on the social demographics data from census. And in general, in this case, we find that the men are more likely, not so much, but it's a little bit more likely than women to use in rural county, particularly for the age group of 35 to 50. So, and then anyway, this is for another model that we fit for faculty and students affiliated with universities. But in general, this is the demand model we use to sample the demand for the second stage when we try to optimize the services. And then we, for each census block, that's how we use the model to sample demand. It's more of a Monte Carlo simulation in this case, and we just simply sample a few hundred days, right? Each day we randomly sample for each small census tract. We think that, hey, based on probability, this person is likely to make a trip, and also based on survey where they want to go, and then that's also everything's tried to be random. Also, we just randomly sample a few hundred days. I think in this case, the results are still being developed, but some of the data results I showed today is based on the simulation, the Monte Carlo simulation in terms of the demand sampling for a few hundred days. We potentially can do more, but right now it's 100 days. Anyway, the focus number 2 is now we can look at the supply side, right? If we know the demand, and then if we had the ability to sample them, hey, this is today's demand. Let's say this is what the demand look like. And how do we strategically deploy the service, right? Design service, whether there's any fixed route or flexible route or on demand, how many vehicles do we need? What type of vehicle do we need? Sizing, seat. So these are the questions that we answer. But then we can go to the operation. We do have the operation kind of pilot, but before that we even do any operation, we have to do the planning stage. So this is some algorithms we have developed over the years. I'm not getting into more details, but this is just so you know that this is the simultaneous pickup and drop off. So meaning that people, it's still very different from the Uber pool or Lyft pool, because you would have someone who requests the service while you still have a few people sitting in the vehicle already. but the vehicle will be dispatched in a way just to accommodate all the people, every single person all together. So we set a very, very high threshold to if to reject any request, meaning that the rejection is unlikely if we offer a full service, but we do consider different scenarios. Let's say we still have one vehicle, two vehicle, three vehicle. Of course, the one vehicle case, you're likely to reject a lot of demand, full demand, if assuming every single person wants to go there, to go some places. And so that's also a little bit of a play supply and demand side, both at the same time. But the key point is that we have some vehicle routing algorithm, in rural county actually making things a bit easier because the demand is not so much. So it's we tested, and I think our algorithm with some insertion heuristics, it actually works pretty efficiently and it works very well, very, very close to the ground truth, at least in the rural case. So here's a few concepts how we design the supply. So we started by looking to the structure of it. I think that's the starting point. If you think about in the county, this is, by the way, I'm not sure if you can see my mouth, but on up a little dot right there, this is Washington, which is another cellular city, municipality of Pittsburgh, but maybe one up is Pittsburgh. Down in the green line, go to is West Virginia capital, Morgantown, right? And then the three dots right there is the most left is the Waynesburg University, right in the middle is Waynesburg City. And then on the right is Carmichael. It's another small little city town in Greene County. So we look at the demand, we think that it makes sense if we are offering some kind of on-demand services to poor people for long distance trips, like people going to Pittsburgh for 55 miles and going down to Morgantown, which is about 30 miles, 25 miles. It makes sense to consolidate all these trips, long distance trips, as much as we can. That's how we can improve efficiency, right? For short distance trips, of course, if we have enough vehicles, we want to get them around. So that can be door-to-door service, that can be on demand. So with this structure, we design three possible fixed route services. And these are the turnaround, depending on the distance, of course, the turnaround is about 1 hour, maybe 2 hours, 45 minutes-ish. And this is designed as a flex stop. That's a common practice in rural. And then anyone on the route that the vehicle will make a very little detour, or maybe sometimes even no detour. But as long as on this main route with a lot of the big box stores or sometimes the small businesses along the way, and people can hail the vehicle anytime, anywhere, as long as on this route. So we designed in the flex stop way. And so that's so something very different from the fixed route in the city. And with that, the hierarchy is such that the fixed route will become the backbone of the major demand, particularly cover university and in the kind of Waynesburg, the county seat, and also the long distance trips as well. The rest of it, depending on where they are, and then will be served by on-demand flexible route services. This is only for the rest of the demand. Again, we have three depots, what we call the three hubs. We will have on-demand vehicle serving, circulating around these hubs. Oftentimes they're far out, but if the system is less busy, so because you really have more chances of picking up someone near the hubs, so the vehicle will go back to the hubs and waiting for more requests. I'm skipping some details, but no, we did a lot of simulation. Like I said, we will simulate the day. I'll give it to a little bit more. I think the slides next is, I want to go to that one. Yeah, so based on the demand model, and based on the demographics, we sample on each day about 1,777. So this magic number comes from, we're assuming every person who's using existing paratransit service is still using it, the same demand. We also have the survey participants give us a model which we'll sample. We also have because if you can see there are different scenarios, but if in the scenario there is a fixed route transit, then that can also kind of potentially stimulate some demand. And then there's a little model that we build in to estimate with the fixed route transit services, people without taking different modes, right? As for people who walk to less than a quarter mile to anywhere close to a fixed route. Remember, this is a flex stop. There's not necessary to have stops. As long as this is the buffer zone within a half or a quarter mile, and there are some demand or likely to use the fixed route without any transfer, without any taking advantage of on-demand services. So that's how we come up with the total daily trip requests. So we sample it as a random sample. So the other thing I should also mention that we also looking to a lot of times the local community was complaining about the impact of crash or incidents on major highways. So that really can block, because they only have very limited choice. It's not like urban. If this is blocked, then you can choose another route. In the rural, it's not the case. We also, that's why having some considerations about how incident potentially may impact the service is also important. That's why we pull some of the data from the incidents data to look into that as well. Okay, so in general, what we envision is a hybrid model. It is, we had the backbone of 3 fixed route transit services serving flex stops, serving people. At the same time, this fixed route only accommodates very small fraction of the total demand. Majority of the demand will be accommodated using this on-demand mobility service, where we will, like, of course, we're looking to the design part of it. How many vehicles does it need for each hub? Is a hub-centered circular service just going around the pickup and drop off simultaneously. So what we think is this potentially could be a good model, and then we're right now piloting it in rural county. So with this structure in mind, essentially what the people will do, there's different modes of transportation. You can see here I listed as the B, S, SB, BS. So this really means B means bus, C, S means shuttle. So people can take a bus exclusively, meaning, again, this is probably not a good name, call it bus, but you will see. But it's essentially just a fixed route. I have to think about what's a better name for this word. But let's, for the sake of presenting this as a fixed route transit, and we use the name bus for now. But people can take bus exclusively all the way if it is close enough to the fixed route. They could also, regardless of where you are, you can always take, potentially you could be assigned a on-demand mobility service. Or it could be S plus bus. The mobility service can take you to some of the bus stops or maybe along the line of the fixed route, and somehow they can, the system is designed in a way that it can sync the time of bus arrivals, and then you can use the shuttle plus bus, right? You can also do bus plus shuttle. You will take the bus, and then once you get off, and you can wait there, and then the shuttle will come pick you up. You can also S plus bus or S, which is most complicated in our simulation. We see the system was never, probably never say never, but there's only the 1 out of the 1,000, maybe 2 out of 1,000 cases, unless the system is super busy and it turns out people where the origin destination are so far out, and then that's extremely rare, unlikely. But in most of the cases, it's either bus or shuttle or shuttle plus bus. Or, I mean, if really the time is so exceeding the threshold, it could be more than 2 hours. I think right now we're setting 2 hours. If that's the case, it will be set as infeasible. We're not really, we'll reject your request, and there's simply no way for the system to make to turn around to move to save you. So we then, in terms of the optimization part, in this case, we simply just consider scenario-based simulation just to pick the one that we think makes sense, because when we deal with local commission's office, they also want to come up with different kind of near-term plan versus long-term plan. And these are the scenarios that we run in our simulation platform. Each simulation, again, like I said, we sample the demand, we give a structure of the supply, and then the vehicle will do as if everything's real time, as if everything is being requested on demand to optimize its dispatch and pickup, drop off of the vehicles, depending on how many vehicles you have. It's both, you can see the scenario. I think I want everyone to quickly pay attention to the scenario D series and scenario E. A to C means there's no fixed route transit. It's simply just the shuttle. And then, of course, we have 3 hubs, and we just assign each 1, 2, 3. The letters in the scenario means that we assign 1 shuttle to each hub, or 2 shuttle to each hub, or 3 shuttle to each hub. The D and the E means that D is a full build-out year that you have. Assuming we have enough money, we can give all the 3 fixed routes, and E is 1 fixed route at the time. Not all the 3 fixed routes can be built out and right now, but let's just try 1 fixed route at a time. And this is actually the scenario that we are doing the pilot based on. We actually picked the E1 scenario. And then we also have some, like I said, the F, G, and H actually is based on the scenario where we have incident. It's a full service scenario, but we have some incidents on highway. It happens some days. Just want to see how this, how reliable, how vulnerable the service is to having these incidents. Quickly, I want to run some numbers. I think I only, the time is, sorry, I've taken a little bit more time than I thought, but I think I only have a few more slides. So this is kind of looking at the service rate, how that means that if it's 1,777 people are this in the bucket of this full demand bucket, look at this full demand square. If we have this many people daily throughout the entire 24 hours, 16 hours actually operation time hours to request the service. And if we were to have C, which is no fixed route, again, D is full service, 3 fixed route, and you have multiple number of on-demand shuttle vehicles assigned to each hub. You can see that that if I don't have any fixed route, my service rate is very low, 26%. I can only get to serve 26% of the total demand who are willing to use this service. And if I have a more shuttle, right, C3, and then I can increase that number to 52%. But if it's a full build-out year, 3 route, fixed route, 9 shuttle services, we can almost serve 97% of service rate. The baseline of service rate at 100 is very high, only because this is a little cheating, because it's based on the current demand of Greene County Transportation Program. Of course, every demand is realized. That's why it's 100. But with the same demand being assigned, I don't think this is a fair comparison, right? Because we really wanted to use this service to serve the much bigger, wider population. So in the E scenario, which is let's say we cannot use all the fixed route transit, we only having 1 fixed route serving within the county, not even long distance trips. And you can see that also the number is not bad. It's actually 46% if you have 1 shuttle serving each hub. And if we have full build out year, this is 93%. In general, we see that the incident does impact the service quality, especially when you only have 1 shuttle for each hub. But in general, it's not impacted drastically, but it does increase by 10 to 20%. So average waiting time wise, you can see these scenarios. Sorry, so the orange bar is hiding behind it. I realize that the graph is not so good. That's why I put the numbers. So the numbers I annotated here are the numbers for average waiting time for shuttle, not for bus. So that means the average waiting time you can see is roughly about 13 to 18 minutes per person if I request the service. But certainly it's going to be much much bigger if you're leveraging the fixed route transit. Because fixed route transit only comes every hour, so you have to wait a little bit, and depends on how, of course, it depends on how busy the system is. If the system not busy, even though you're able to take the fixed route transit services just to improve the service quality, we will have the dispatch, the on-demand services to come pick you up. So that's also not a very exciting number to us. We also look at the emissions. DOE wants to look at how effective the service is, not just the cost, but also the kind of service emissions, CO2 emissions. We look at the other emissions. Well, this is just the size for CO2 emission. So you can see C's is a pretty low per person emission energy consumption. So C1 is just to remind you, there's no fixed route transit. Everything's on demand. But keep in mind, C1 can only serve the 6% of the total demand, right? You're talking about a much lower service rate, but at a very low energy consumption rate, which is only 0.4 gallon per person, which is okay. But in the D1 case, if we have 4 build-out year, 3 fixed route, 9 shuttle, this is 0.9 gallon per person, because you're certainly serving some of the long distance trips. Yes, per person energy consumption is going to be bigger. But what's really amazing is this E1 scenario. E1 is the scenario that we only have one single shuttle. And services, you can see this serves about 46% of the total demand for demand, right? And then, but the energy consumption is only 0.2 gallon per person, because you have not all the long distance trips being served, but you're only serving within county. You can serve almost half of the demand at the really relatively low per person energy consumption, and as well as the emission. So that's why we're really doing the E scenario for now. We look at all the scenarios that there's potential we can run more, but this E scenario is what we are trying pilot right now. So the other, that's, I promise this is the last, this is the second last slide. We look at the cost for the whole county to run this service. I think with the inflation and everything, we're that's the estimate is the $60 per hour per shuttle. And because we look at the occupancy of all the fixed route, as well as on demand, we see no case where the occupancy of the vehicle will exceed 5. And so that's why I think the minivan, which theoretically can take 8 people, can potentially work. That's why in this case, the pilot, we actually get a few minivans, Odysseys from Honda. We are testing out the services right now. We thought that the minivan service will be okay. So that can also drastically reduce the price. The $60 per hour is the price that we estimate for a 23-seat shuttle, and that includes all the maintenance, vehicle label. That's basically renting the vehicle as well as paying for the driver. But if you use a minivan, not only the cost of vehicle is much lower, but also because in this case, minivan, the driver doesn't have to carry a CDL license, right? It's also very critical that the pool that you can recruit drivers is much bigger. And so also, I think I talked to local folks and they really like the idea of not hiring a CDL license driver versus, can just hire, we're talking, remember, going back to the volunteer perspective, because the minivan can also be driven by volunteers as well. So that can also drastically reduce the price. But anyway, the point is that in general, you would expect that in the full build out year, if we do have everything, all the 9 shuttles on daily basis, around 16 hours a day, and all the weekdays, you're expecting a little over $2 million to provide a quality service. But if you use minivan, that's roughly over $1 million a year. I think that's give you some sense of how much it costs this to run the service. But we are only talking about on demand, but the fixed route transit, depending on the vehicle, that's possibly another $1 million or so, depending on how frequent that you want to run the fixed route. This is the last slide, and we're very excited that we are just launching the program called RAMP in the Greene County. And actually, this is we developed the app and for both riders and drivers and managers. It's all the different 3 types of users. And for the rider side, you can use it. So we're not really professional software engineers, but just bear with this. not so user-friendly design, but I think that it's okay, it's usable, and then user can enter their origin destinations, request time and everything. And we'll recommend them different modes of transportation. And then typically, like I said, say 60-70% of the time they will be assigned with the on-demand shuttle. And they can get the message of saying the vehicle will pick you up, and you can have a real-time view of the ETA of the vehicles. And then the driver can check in, and we kind of program pretty much everything. It's still a beta version, but we are testing out. The program it's already launched, but we haven't really got any so the recruit any user. There's also IRB process, and but I'm pretty certain that we will start actually operating the vehicles there. The program has been built. We have hired the program manager, but we're hoping to get everything, actual riders to use the service starting from next month. So that's the plan. But also approaching the end of the DOE grant, that we're hoping to close out by the end of this year. Okay, so that's everything I have, and happy to. Sorry to taking more time than I thought, but happy to take any questions and comments, suggestions. Thank you.
Great, thank you so much. It was very informative and inspiring talk. Starting with questions, so I would like to give a chance to that class from Dr. Qian if there is a question from that class. So we go from there.
Sure. Thank you, Ali. Guys, if you have any questions you want to ask, some questions. I do have one question. So regarding the pilot, so are you going to buy the shuttle and operate yourself, or is it going to be the transit agency?
No, it's we actually get like I said, we got the vehicle from Honda.
Okay.
Honda give us they have a free loaner program for research, and I happen to have a lot of projects with Honda, so they very generously give us 3 Odyssey 2021 Odyssey.
Okay.
And then we use the vehicle. Actually, we have to install a lot of things, like the dashboard cameras, and just making sure that both the driver and passenger are safe. Things like that. We have to also buy the 4G kind of SIM card, and just to connect the vehicle with. I mean, there's a lot of things they have to instrument. But Honda give us the vehicle. We're renovating, so doing a little bit of in-house instrumentation of the sensors and things like that.
Gotcha. We're running a very similar project right now.
Okay.
And then so several questions that come out of my mind is, who's going to pay for the drivers? That's another thing. What about liability? So how do you negotiate all those things? It's very practical.
Yeah, we can discuss offline, but I think this is it is a very important critical process. And unfortunately, this is a long time process. I think it's fortunate because we really want to have all the IRB and protocol, everything being proved, liability as well. So we have a local nonprofit that we're helping us. It's called Blueprint, and they have hired the drivers. They have hired a program manager and who will hire drivers, and they get paid. And the local insurance company has to be on board. They have to approve everything, right? We also have a bailment agreement with Honda, just to and there's so many agreements that you have to sign. That's right. So, and then also the liability issue. That's why we have to install the dashboard camera both inside the vehicle and outside, and making sure the driver is safe. In the rural counties, there's a lot of safety concern as well. We also, because like I said, there's places where you're not really getting any 4G or even 2G. That's why every driver will be equipped with a phone number. And then initially the pilot stage, we make the very clear, there's a kind of AT&T or T-Mobile map of the wireless coverage, and so we can only serve the community for now. I think that just as a testing set, within the 2G coverage, at least we want to have the cellular information, right? If people are unable to make calls, there's certainly a lot of liability that we cannot afford at this stage, but we certainly want to explore more in the future. But certainly, yes, we can discuss more offline, but this is a long process.
Leave the time for others, but thank you, Ali.
Great, thank you. So I think there is one question in the chat box. Eric, you want to go ahead and ask your question?
Sure. I am just curious if were the surveys conducted, I didn't quite understand, were the surveys conducted at a third location all the time, or were some surveys conducted, were you able to get to people's homes? Because I know with rural areas, people who do not have access to transportation, sometimes they're
Correct.
sort of locked in at home. And so
Yes,
there's a whole
exactly.
group of people who can't be
Yeah, so
surveyed
for
at
the
their location.
sorry,
Go ahead.
little lag and making sure. Oh, okay, so I will answer your first question. So yes, I think that's why very important to work with local community leaders and nonprofits. And in this case, we have 4 or 5 at the time we do the survey. We have 4 or 5 nonprofits that are helping us. We did recruit some of the students to go to the main kind of gas airports and things like the farms just to do a survey. But we also, I believe it's probably more than 60% of the surveys are taken either by making a phone call or the nonprofit going to a senior citizen center and go to some more of a churches when they have people gathering. So it's yes, the short answer is yes, we kind of want to get to people's home or their residence just to get a better understanding what they need. There's also a phone call that we made. Also, there's online survey. We did take a look at online survey. I think the online survey most of the students and faculty in Waynesburg University, they do a lot of online surveys, but the residents is probably only 10-something%. It's a very small portion that people did everything online, but most of it are based on the paper.
Thank you.
I do have one question. As far as the software, the application software that you have developed, is it something that you're planning to also make that available, or perhaps potentially have a workshop later for the application software that you have designed? So any way that we can benefit from that work, because that is something that we are also exploring as well. So
Yes.
and we would like to learn.
Yeah,
from
we're happy to Ali. So that's a great question. I get this question a lot, and yes, we're happy to open source everything as long as you think this is helpful. But right now, like I said, we are in the beta version stage. We are still tuning, and my goal is after the closure of the DOE grant, like I said, maybe towards the end of this year, and then we'll share open source all the tools that we have been developing.
Wonderful. So any question from online or this group here? Curious to know, you were calling it hybrid services and perhaps with this software you try to go to a sort of integrated services as you move forward. Was there any insight into that sort of going that route?
Sorry, you said building the survey into software?
No, you were mentioning this sort of service that you have been providing in a sort of hybrid service model that you were having. So looks like that you are heading to a sort of integrated mobility services.
Yes.
With the development of the app and so on. Could you comment on that?
Yeah, I think the software would there are 2 pieces of it. The software, one is the algorithm part. The algorithm part, yes, it is that's why we have so many modes of transportation. And again, the system will assign, in this case, right, people can request. I think the goal is try to give people the options. If you want to go to A and B at the time C, and then we'll tell you, hey, these are possible 3 different modes to get there because there's a hybrid system. And you can prefer, choose something that I really want to go with this option. The software is designed that way. But we also system will strategically recommend. I will tell you this is recommended because this is really the beneficial for the entire system. So there's an algorithm on the assignment and the recommendation side. But on the other hand, in terms of implementation, the apps, yes, I think that for both planning and operation, the planning stage, the algorithm, we don't have the software yet on the planning stage, but the software is supposed to to provide the agency some recommendations in how to construct this a hybrid model. And in terms of operation, the operation of the software has to be fully support that. So again, I think this is like I said, we still in exploring. It's nothing is set stone. I just thought the structure hierarchically, this is hybrid service makes sense. But we don't know yet, and I really don't want to say for sure this is the best service, and we want to try things out and to see what's the feedback from the local community.
Okay, great. So, go ahead.
Yeah, thanks, Sean. That was a really insightful talk.
Hi, Ren, how are you?
I was just curious about just broadly, like, are you also planning to keep it in, bring the costs to public at ever, or will it always be free? Is that the vision? And if so, like, how's the kind of maybe the price distribution and all that? Is that being
So
considered
when you
at
say
all?
cost and price distribution, can you be more specific?
Just like I think you mentioned something about like each shuttle costs about like 9,000-ish. So like I'm wondering, like, to keep it sustainable, like is it ever a thought to kind of bring the cost like some dollar per ride, something like
Yes,
that?
that's a great question, Ventesh. And I had a lot of discussion, and you know, practically in a pilot stage, we don't want to. Especially, I think this grant is supported by Department of Energy, so we're not really charging them anything. You know, but we do want to give them a sense this will eventually be a cost. So we build an app. But now, right now, the pilot stage, what we do is to everyone sign up, we give them some credit to use, but every time they consume credit. But we also talk about the long-term plan is to, you know, every state, I'm sure in Alabama and North Carolina, they also have this statewide, you know, the guideline of how you want to price the shuttle services. In Pennsylvania, like I said, this is probably up to the number that it's probably $26.99 up to, you know, 30 miles or something. And there's a distance-based fare structure that we have to follow. Depending on where you get the money from, right? If you get the money from the supporting money from the state, then you have to follow that fare structure. And then we did some calculation. I think I'm very optimistic that if we can really truly getting this many riders with the service rate of being 60 to 70 and 90%, if we can truly ensure the same quality of service, I'm pretty optimistic that this can break even with the current statewide structure of the fares, PA. But the issue of the structure of the fare is set really high. Like, I don't think that anyone who wants to pay for $27 just to make a trip to Pittsburgh with the service. But again, like right now, the status quo is that a lot of these trips are highly subsidized, not only by DOT, you know, federal agencies, but also by healthcare facilities, right? So the insurance, in other words, the healthcare insurance is kicking in to pay for some of the service. And then I can certainly think about this way as well, and potentially we can leverage some other resources from employers. Like say employer like Amazon build their warehouses, which is they want to attract some of the workforces, and then we can work with the HR, and then they can pay for support some of the service. I think that it's not exclusively coming from the federal. The revenue can also come from the rider, can also come from different big employers, gas stations, and, you know, things like that. I think there's a whole lot of room to work around.
I think there's a lot of interesting questions in that space, like the payment structure and all. But yeah, thanks for the insights.
Great. Any maybe last question? So just one question. The app hasn't been launched yet, but before that, you might mention it or not. I might have been missing it during your talk. What was the mechanism for booking the rides in the absence of that app that was not launched, and perhaps you have been using mix of different methods. Can you comment on that one?
So the mechanism of requesting the trip or
Yes.
it's not- I'm not sure what exactly you mean by mechanism, but essentially it's everyone can use the app. I mean, it's a well, maybe you're asking about the technology, but so it's a web. It's not a phone app. It's essentially just a web page. Everyone can scan QR. I mean, they can. We give it some very easy name to remember. But other than that, people can also call. That's why we hire the program manager sitting to the central office, just like any transmission program you have to run. And then the citizen can either use that phone app or not phone app, sorry, either a smartphone, their computer, iPad, or they can also call directly to the program manager to book the service. And then because this is real time, it's not day ahead. I'm not sure if this answers your question.
Yeah, and do you have any insight of which one was the preferred methods based on your pilot?
I know
Phone
based on our survey, yeah, I think it's gonna be I mean, we did ask people, which way you feel more comfortable. I think the senior citizen, depending on demographic of the population, I think senior citizens certainly feel more comfortable calling. That's why it's very important. We don't know how the percentage, but the calling is almost the exclusive of the primary source for senior citizen. But for younger population, I think that most of them feel comfortable using the computer. So they will book everything based on the web link.
Okay, great. So with that, I would like to thank you again. It was a very informative talk, and thank you everybody also joined this meeting today. And thank you, Dr. Qian. It was very informative. Thank you so much.
Thank you.
Thank you.
Yeah, we'll be back in
Thank you.
touch. Bye.